What is stress urinary incontinence? It is when you have involuntary leakage of urine when you cough, laugh, sneeze, or when you're running. Pelvic support problems. So if the tissue that supports the urethra becomes either stretched or torn with childbirth or with aging, you can have this problem. So Kegel exercises are exercises you can do to strengthen the pelvic support muscles. So after you empty your bladder, you want to squeeze the muscles that cause the stop the flow of urine. And you hold that for about 10 seconds. Release, and then repeat that about 10 times. And after about 2 weeks, this will become a habit. And you should see some improvement in 4 to 6 weeks. There is a very safe and effective treatment, surgical treatment for stress urinary incontinence. And it has to do with the placement of a sling. A sling is a narrow strap of synthetic mesh that is placed underneath the urethra that acts as a hammock. It lifts and supports the urethra. Abnormal uterine bleeding is when you have a heavy period, right? More than normal, or you bleed more days than normal. It can be also when you have a menstrual cycle that lasts greater than 35 days or less than 21. Another reason is if you have bleeding after menopause. The causes of abnormal uterine bleeding may be due to normal or abnormal pregnancy, a miscarriage. It could be due to masses you have in your uterus, a fibroid or a polyp. It may also be due to uterine cancer. And what can you do to test for this? One method is if a person's over the age of 35 or has other risk factors for uterine cancer, you place a small tube through the vagina and into the uterine cavity to obtain a sample of the lining to make sure there isn't any cancer. The most common medications used are hormonal, and typically that's with oral contraceptive pills. You can take those. Another method is a Nexplanon subdermal implant. This is a little rod that you place underneath the skin in your upper arm. And another very effective method is with a Mirena intrauterine device, which is placed in the uterine cavity.